ACL injuries of the knee typically occur in younger athletes. They usually require surgery. But would an active person in his 50s or 60s need ACL reconstruction surgeries? I'll discuss the pros and cons of surgery in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on my channel. Here's the question. I'm a 67-year-old male, moderately active. I suffered an ACL injury, a complete tear. I'm trying to decide if surgery is worth it. Now, like I always say in this video and all my videos here, I'm not giving specific medical advice. This information is just that. It's meant for information and educational purposes only. The ACL is the big, thick ligament in the center of the knee. It's involved in stability, preventing the tibia from shifting out from under the femur, such as when you land from a jump or when you're running, plant your foot, try to change directions. In those two circumstances, especially in younger people, after you tear an ACL, the knee's unstable, the tibia can shift out from under the femur, and you can do more damage to the knee. Typically, and this is really historically, this was thought to be an injury you didn't do in people under the age of 40. In fact, when I was in my residency training the sports medicine orthopedic surgeons, that was basically their rule of thumb. If you were 40 and older, you didn't do surgery. We've largely gotten away as orthopedic surgeons from the age criteria, and it's been more about, one, if you're still doing high-level sports that involve activities such as landing from a jump or changing directions, and if the knee is unstable. And if you're going to be, let's just say it's somebody that's in his or her 50s or 60s, but played high level soccer, rec league soccer, that'd be a tough activity to do without an ACL. And so, yes, you would conceivably at least talk about doing that surgery to prevent instability. It has really nothing to do with preventing arthritis. Yes, it might decrease the risk of post-traumatic arthritis more than leaving it without a functioning ACL, but ACL, even after ACL reconstruction, you can still develop post-operative arthritis. So it's really more about stabilizing the knee. I don't operate anymore. I focus on regenerative treatments. But back when I have done, I think the oldest patient I had that I did an ACL reconstruction was 61. She was a multi-level, high-level black belt in karate and wanted to do it. And she did great after that surgery. So yes, it can be the right thing to do. But if your knee is not unstable, you do an activity, again, this is for people in their 50s and 60s, you do an activity that likely isn't going to create an issue with instability. For instance, if all you do is walk or straightforward jogging, maybe it's not as necessary there. But again, in activities that involve especially landing from a jump or changing directions, planting your foot and changing directions, after an ACL tear, a lot of times that knee is unstable, and it can be a reasonable idea at least to consider surgery. Now, I've written an ebook you might like. It's called the Arthritis Solution. You can get a copy of it free if you click the link in the description below. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, there's a link in the description under this video. You can click that link. It'll take you to a contact form that's on my website. You can fill that form out and learn more about scheduling an appointment with me. I'd also love to hear about your experience with your knee injury, so leave those in the comments below. Just understand, like I did here, if you leave a question in the comments, I can't offer you medical advice there. So what I do a lot of times is answer that question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.